Hello, everyone, and welcome to Menopause Science, a scientific community powered by TaraCares. My name is Jyoti Sharma, CEO and founder of TaraCares. By 2025, 1 billion women will be in menopause transition. That is 12% of the world's population. Menopause transition causes a wide range of individual symptoms that are unique to each woman. So one size fits all does not work when it comes to menopause healthcare. TaraCares is an AI health tech startup committed to addressing unmet global health needs in menopause awareness, diagnosis, and management. We are carrying out multiple international research studies investigating the experience of women going through menopause and building AI-driven digital health applications for women and healthcare professionals to make it evidence-led, individualized, accessible, and affordable. On the Menopause Science channel, we cover foundational knowledge on various aspects of menopause transition. We work with a carefully selected set of experienced scientists, researchers, engineers, technologists, and entrepreneurs who value science and robust research to inform women's health. Today's session is co-created by Professor Vikram Talaulikar, a specialist in post-reproductive medicine at University College London Hospital, and myself. The topic for today is progesterone and hormone sensitivity for HRT. HRT, as some of you may know, is hormone replacement therapy used commonly as the gold standard for treating menopause symptoms. So what is progesterone sensitivity and why is it important to be aware of it? Some women can have intolerance to progesterone, resulting in a wide range of symptoms. Progesterone is a female sex hormone that is naturally produced by your body during your reproductive lifespan. And many of these symptoms may be similar to what you experienced as premenstrual symptoms. They range from bloating, fatigue, insomnia, depression, breast tenderness, many symptoms that we as women are quite familiar with through our reproductive lifespan. Click on the link in the comments section to follow the engagement and comments by other practitioners on Vikram's original LinkedIn post that inspired us to share the knowledge with you through menopause science. So, as a woman, we ask, why are some women sensitive to progesterone and others not? Why am I sensitive to progesterone while my friends can freely take HRT with no complications? Unfortunately, the answer to the question is not well understood, and many of us, including TaraCares, are working to get those research studies funded. The answers may lie in hormone receptors in your body, your gene makeup and composition, and how hormones are being absorbed in your body, which is different at a cellular level and at the tissue level. Many women who have such sensitivity have past history of unpleasant premenstrual symptoms, which happen with the rise of progesterone and the fall of estrogen, especially in the second half of your menstrual cycle. So, if you track your periods and your symptoms, it may be useful for you to see and monitor which symptoms appear in the second half of your menstrual cycle. A good tip is that if you have a history of not tolerating the contraceptive pill, then you are most likely susceptible to sensitivity to progesterone. One asks, how can this result in unequal care and access to integrated health options and treatments available for women? Number one, women can be put off or denied HRT or certain types of progesterone preparations, which prevents them from utilizing the beneficial effects to cope with anxiety, sleep, and other menopause transition symptoms. So it's very important for you to very carefully assess the risks and your intolerance before you make a decision whether progesterone is fit for you as an HRT option or not. Number two, progesterone can have significant benefits for women with endometriosis. And number three, to protect the womb lining and endometrial protection, women who have their uterus intact require progesterone because we need it to oppose the natural or HRT prescribed estrogen. So a few things to consider before you put off progesterone. HRT as an option for yourself, or have an intelligent conversation with your healthcare provider who may or may not be aware of these details. So, let's say you are sensitive to HRT, but despite that, you wish to or need to take progesterone in your HRT. What is your way forward? There are several commonly followed and easily accessible medical approaches that can help you if you wish to continue HRT despite your progesterone sensitivity. There are different forms and types of progesterone treatment that exist, which can be used to see which one suits your body better than others. It is important to note that some of these HRT regimens have plenty of scientific efficacy and safety data, while others are off license, and they need to be individualized for your body composition and your tolerance levels, with safety checks for monitoring your womb lining on a regular basis. In the UK, the British Menopause Society has published guidelines on progestogens and endometrial protection. It is important that women have a discussion with their healthcare provider about pros and cons of each approach and what options they may have available to themselves. So speak to your GP or your menopause specialist or your gynecologist for a method that is most suitable to you. We hope you found this session useful. Please tell us through your likes and comments what topics you would like to be included in these sessions for future. Hit that bell icon for notifications, as we have quite a few research bites that our team is working on. Until then, have a wonderful day ahead. Keep smiling and take care of yourselves. Goodbye from Vikram and myself. Take care.